All right, welcome Women's Advantage family. We are so excited to have you here today. This is the first of our monthly webinar interview series that we have started. So we decided to choose these quarterly themes and then monthly topics at our physical therapy clinics and be able to provide more community education, community outreach to talk about the subjects we love. So July is Pregnancy Month. We're going to follow that up in August with postpartum and in September with return to life postpartum, really talking about how to return to exercise and how to return to sex. So today we're talking more about pregnancy and birth prep. So we are very excited to have with us a longtime labor and delivery doula, Lysa Quealy, who is located down in San Pedro, California. She also is a massage therapist with an extensive background and training in a lot of specialty massage, which we will get into a little bit. And then I have Dr. Christina Vivit with me today as well, and she's going to be moderating a bit and talking about questions, posing questions to Lysa and I. So Lysa, we would love for you just to give us a little background about your training and how you have been so impactful in women's lives during their pregnancy and postpartum periods.
Well, hi everybody. Wow, this is exciting. I've been a doula for almost about 18 years, a massage therapist for about 28 years. And I primarily do birth. So I'm not big on postpartum, but I do have lots of information to share about postpartum care. So massage is amazing. It can help relieve discomfort before and after the baby, help prepare you in lots of ways. So just ask away.
Excellent.
That's great. So Lysa, just a general overview. Can you share with us what the doula's role is in birth prep, pregnancy, postpartum, just general idea that you can share with us to start off with?
So there's a really large variation of what a doula is. A doula could be your mom, your sister, or it could be somebody who got an education and got certified in becoming a doula. And there's several organizations that can do that. DONA is the one that I chose when I was becoming a doula. There's a lot more now available. So we are there to be your companion, to be your support person, maybe help you ask questions, get to know you and your family and what are your needs, what are your goals in birth. Sometimes we're there to support a family through even miscarriage. So it doesn't have to be just birth. And it can just, we meet early, hopefully in the pregnancy. Even some women hire me before they're pregnant. They are trying to get pregnant. So, and then there's everything in between. You become friends, you become, part of their family a lot of times.
That's beautiful. That's beautiful. I really like that person, client-centeredness that you bring in with your practice as being a doula, because you really emphasize that, we're not here to tell you what to do. We're here to be a companion. We're here to be nurturing and listening and collaborative with the birthing and birth prep process. So I really like that. In terms of doula versus midwife, I think that's a hot topic in terms of what are the differences. Can you tell us a little bit more about those differences, and as well as how those two roles can also fit well together?
Yeah, well, a lot of people think doulas are midwives, and we're not. We're not there to help give medical information. We can certainly help direct you to make sure you're getting evidence-based material to answer your questions. We can help direct you to do your research, but we are not medical professionals. We do not provide medical advice. And that's what your midwife's for. She's like your obstetrician. All your prenatal care, if the She's your
We are not medical
care provider.
not provide medical advice.
Very good. Yeah. I think that's a good good answer, because I think a lot of women tend to have those questions of would I need both? How do both work? What are the differences? So I think that's a great answer. In terms of Jenni, what do you think? Where does the pelvic floor PT and doula come into play? So we talked about doula and midwife. Let's talk a little bit more about pelvic floor PT and doula.
Yes. Well, I have to say I love doulas, and I don't know why anybody would birth without them if they had the opportunity. I had one with all 3 of my births. 2 were vaginal, last little booger was breech, and she wouldn't flip, and I had enough anxiety about having to have a cesarean birth that I took my doula with me to the C-section as well. Now, they did have limited people that they allowed them in the operating room, and I was able to get both my husband and my mother-in-law, but she was just invaluable in being able to support me during that time. So I love being able to have the interactions with the doulas and the midwives in the idea of what we do for birth prep, being really looking at the pelvic floor and its ability to lengthen, what birthing positions might be really helpful for women to prevent perineal tearing. We are looking at how do mamas have the least amount of pelvic floor challenge, physical challenge after baby is born, so we can get them recovered to where they're really thriving again postpartum. Because having your first baby, second baby, however many, it's a very humbling experience that if you thought you were strong through the whole pregnancy, that once you deliver, it's still, there's a lot of changes that have happened in your body that you aren't necessarily expecting or comfortable with. So in working with doulas to be able to really think about, one of the things that we do in the clinic is if a mama knows she wants to deliver without an epidural, and we know we can get her into a variety of different positions, we want to hook some biofeedback, which is surface EMG, to that mama's pelvic floor and have her do some practice gentle pushes, obviously not like straining like you're actually in birth, but practice pushes in a variety of positions. In typical lithotomy, where women are lying down with their knees up, with side lying, with hands and knees, with tall kneeling, with standing, which in whatever positions they feel like their body moves well into, and see when they bear down, does it cause increase of pelvic floor activity, or are there positions that are particularly good for some of our mamas that they can keep their pelvic floor activity really low? We want a pelvic floor relaxed during birth so they have less chance of tearing. So if a doula can come into that appointment with their client and we can look at, okay, we've tried 5, 6 positions. These 2 are the ones that this mama does really well in. Then the person, the doula that's with them during the actual event, I wish we could be with them during the actual event, but the doulas that are with them really can help say, you know, those were 2 great positions for you. Personally, in my first birth, I had really severe tearing, and my doula knew that I really needed to be on hands and knees with my second baby. And, you know, when you're in the midst of the moment of getting through the contractions and doing the pushing phase, sometimes it's hard to remember what is going to be the best for you. And I was on my back and I was pushing, and she looked at me and she looked at my OB and said, you remember, she had a really bad tear with the first one. We really need to try to get her flipped over. And so I needed that because I was so focused on every contraction. I needed that person, and that would not have been my partner. Love him dearly, would not have been the one to go, hey, remember, flip over. So the doula's role was really important there. And she was able to nudge us both into, okay, let's flip over and let's try this other position to help me protect my pelvic floor, because I really didn't want such extensive, I don't like to use the word damage, we'll use the word challenge to my pelvic floor or to anyone's pelvic floor. So I really like when we can see a patient early enough in their pregnancy and be able to have that team work with their doula to be able to help that mama get to the least amount of perineal challenge during their birth. So I welcome their collaboration any and all the time.
And I appreciated that help every time I've had a client and been able to come with them to that appointment. It's so informative for me to know how I can help them best. That's my job.
Yeah,
So,
it's really fascinating.
Yeah.
Lysa, do you have any examples on your end to share of your experiences with the pelvic floor PT doula collaboration, either during the birth prep process or the actual birthing process?
You know, every pregnant woman that I work with, whether it's via massage or if I'm their doula, I always recommend that they get their pelvic floor taken care of before birth. At least for us to know what we're working with. If there's any scar tissue that could inhibit or make pushing more difficult. So it's just good to get evaluated. And then of course, postpartum, that's the first thing I say is as soon as you're released from your midwife or your obstetrician, hopefully you already have that relationship with your pelvic floor therapist. It's so much easier to go in and talk about maybe you have some urination issues or some painful sex or something else going on. So it makes it so much easier to recover afterwards too. So yeah, it's always recommended.
Mm-hmm. So in terms of, both of you guys talked a lot about the importance of good positioning and positioning prep when we're preparing for a successful delivery. So Jenni, can you talk a little bit more about the different positions that we can work with when trying to think about positioning for pelvic floor relaxation and optimal pushing?
Yes, I would love to do that. One of my favorite topics. So when you look at the research about this, now most of the research is done in Europe. We're finding it in the international Eurogyne journals versus in our journals here in the US. One of the most recent studies in 2018 really talked about side-lying positioning and delayed pushing. So oftentimes we'll see a mama get to like 9 centimeters, 9.5 centimeters, and their birthing professional will say, do you want to practice push? And first off, mom is going to get tired. I mean, pushing is going to take a while. And so maybe not the best idea to add more stress and fatigue on the pelvic floor, more stretch on the pudendal nerve, which is the nerve that comes in and innervates the pelvic floor. It gives us sensation and it gives us strength. So they really recommended delayed pushing until 100% of dilation, so all the way to 10 centimeters of the cervix being dilated before pushing started. And this study was specifically in side lying. So if you think about how that would look, mama would have to be on her side, knees towards her chest, maybe at 90 degrees. And the top leg would be the only leg that needs to be supported. So there could be a nurse, there could be a partner, there could be a birth ball, there could be anything to keep this up. But if the physician or the birthing professional is behind them, whether it's an OB or a midwife, then they still have perfect viewing of the perineum to be able to see that baby to birth. When we're in typical lithotomy with our knees back and open, our pelvic floor muscles are at their biggest stretch. And then to allow a baby's head to come out the vaginal canal, those muscles are having to lengthen 3.5 times their normal length, which is a lot. I remember at 37 weeks with my first one, I just thought, oh no, like how is this baby coming out of that? So that's just not gonna work. And granted, there's a lot of hormones and things happening that really help us be able to elongate well and allow a baby out. But we want to give the pelvic floor its best chance. So if it can be more slack before a baby's head descends down, then we've got a better chance of just needing a couple repair stitches and not having a significant tear there. So that being said, that's the strongest research is in side lying. Now, research prior to that really liked side lying and quadruped or on hands and knees. And again, personal story, hands and knees, I thought with my first baby, there's no way. I don't want my butt up in the air. I don't want my mother-in-law, my husband, you know, who knows what's going to come out of there. And so I did not go into quadruped and then had a really bad tear. And so my second one, when they said, you need to flip over, I'm like, great, we're going there. Let's just get in that position. And I actually felt extremely strong on hands and knees. I could really arc up and get my diaphragm locked down and my rib cage locked down and be able to have the pressure gradient to help me push really efficiently. So that one worked really well for me. Now, we hear a lot about squatting, and Lysa, I'd like to know kind of what you see, not clinically, in the field, in real life about squatting, because what the research shows is US women have more tears with squatting because it's a little bit faster, and we just don't relax well in squat. We have tight calves, we have really muscular backs because we sit all day, and we don't squat that often. People in countries that they squat to defecate, they squat to have meals, they squat to wait for the bus, they squat to have social interaction with their friends, they do beautifully in a squat. They can relax and hang out and be there for hours. So for them, they do really well. Now, a mama who does a ton of yoga, who has practiced being in that full squat position for a long time, she may also do great. Those kind of people, I'd love to put the biofeedback on them so we can actually see, do you relax really well in a squat? And then great, go for that position. So, you know, you can look at the research, but then we also need to look at each individual person, because we also need to think about those mamas who maybe have a lumbar disc injury. And with those, they should not be flexed forward and pushing, because they're going to create a lot more stress onto their disc injury. Or somebody with spinal stenosis, kind of the opposite. We don't want to be doing a lot of extension. Or somebody with pubic symphysis pain, which is where the pelvis comes together in the front, that little area there, it starts to separate when we're pregnant. It separates further when we go to deliver. But if somebody has a pre-existing pain there, we want to keep them from letting their knees open too much. So using some TheraBand to wrap around, or getting them on hands and knees so their legs are locked in one position and they can't really get pulled back like this. This makes me think of chicken wings, like when people used to like break chicken wings for wishes. Anybody? I'm the oldest. Yeah, okay. Nobody's heard that. Maybe it's a Southern thing. But we don't want that. We want to be able to limit that. So PT-wise, we're thinking structurally, what is the best position to be able to protect pelvic floor, but also if they have any other things like hip injuries, hip labral tears, what can we do to protect those joints so they can still have a vaginal birth and not immediately jump into having a C-section? So Lysa, with your clients, what position do you see mamas delivering in the most often if they don't have an epidural?
So it really depends, and I really do use the squat bar a lot, just because it gives us another option to be standing, and they can standing and squatting, but then and then depending on the woman's size, if they're smaller in stature, it's really convenient to lower that foot of the bed if we're in the hospital and just kind of squat, and then they can lean forward and relax in between contractions. But something really interesting that I've used several times that works really well is just tying a sheet to that squat bar and letting them put their feet up there, and so that they can really relax. If they don't have that leg strength anymore, or if they're really tired, that allows them to have lots of power in their core and really relax their pelvic floor. So yeah, I've seen birthing from everywhere, from just standing and catching their own baby.
Oh.
Yeah, and it's usually like not purposeful, it just happens that way.
A little faster than what was expected, huh?
Yes. Oh my goodness. Yeah. So I can't say, I mean, hospital births, I have to say, more prone. You know, doctors tend to prefer you laying on your back.
Yeah.
Midwives, I almost always are using a birthing tub. So that can be a lot of in the tub, but you're much relaxed in that warm water, and things tend to move a little quicker or easier when you're birthing at home. It just does.
Yeah. So I know in the hospitals, once your water is broken, you're not allowed in the tub. But in home births, I assume that that's not a problem, that mamas can stay in the whole time, they can deliver babies in the tub.
Yeah, and again, it just depends on the family and what they want, but usually it's more towards transition, the end of labor. If you get in the tub too early, it can slow things down. So you don't want to get in too early, but certainly in early labor, it's nice to take a nice shower and relax. But once you're right there and getting ready, yeah, you're usually in the water, and women just are able to let go and let that baby come out. Not too much effort. So squatting is a very common place to be.
Mm-hmm.
Yeah.
Excellent. Thank you.
So sounds like we need quite a bit of energy going into this process. In terms of energy, what are some things that anything that you guys can think of at all, food recommendations for getting ready to have your baby? In terms of what's the most energizing, clean, and sustainable energy sources for intake before we have our baby?
So Lysa, do you want me to grab that, or do you have some strong feelings about that?
You know, I think it's really personal. I think everybody gets there their own way. I encourage hydration. That's a big one. Lots and lots of water. But some women need to eat, and other women not so much. And really depends on how long the labor is. And so having lots of food around that they enjoy, and maybe a lot of fruit that has a lot of water in it, things like that. You know, I don't really recommend a big juicy burger or something that because, like, kind of, you know, you don't want anything heavy, but I don't tell them what to eat. Lots of snacks are important.
Mm-hmm. I remember being told soon as I went into labor, make sure I got some calories in me, because this was going to be a long 20-hour, 24-hour marathon. And so something with electrolytes, because you're going to be sweating a bit during the pushing phase, lots of fluids, but also things that were easily digestible, like bananas or yogurt, or I like the fruit option because you're getting that sugar that you need for the short-term energy, but you're also getting some fluids there. I had a very dear friend that I was at her birth, and she had labored at home for quite a while. She got into the hospital at 8 or 9 centimeters dilated, and we're with her through the pushing, and I thought, she's not sweating. Like, no, and she's working hard. And it ended up at home, she had not hydrated at all. And I kind of looked at her husband and said, you need to start giving her ice chips. Like, she's obviously low on fluid. And she delivered, and then she passed out, basically. Her blood pressure went so low that they then had to do an IV and start getting her fluids back up because she had not hydrated. So definitely making sure you're drinking enough and peeing often, because the bladder is kind of underneath the uterus. So if you're not emptying, it's a little harder for baby to drop down and in. But I'd say that's the biggest things that I have always been taught about prepping for energy for birth.
Very good. In terms of home prep for both of you, I have a question here about positioning just in general in the last month to optimize your baby's positioning when your baby is on its way out. So avoiding that sunny side up baby. Do you both have any suggestions for that for our moms?
I like spinning babies. Oh, sorry. Go ahead, Jenny.
Okay, well, I'll tell you what I know, and then I would love to hear your part. So, in general, when mamas are in that last month and their feet are a little swollen, often we see them sitting on a couch or sitting in a chair, kind of back with their feet up. And because the baby's spine is the heaviest component, it lays face up, just because of the weight gradient. So if mamas are constantly leaning back, feet up, we're just promoting that, what we call sunny side up. We want baby to be face back, face towards the tailbone, because as the baby's head comes out the vaginal canal, there is a reflex on the back of their skull at the nuchal line that when they hit that part of the pubic bone with that part of their skull, it tells them to extend their head back. So it helps them come out of the vaginal canal instead of coming straight down the vaginal canal and having a little more impact on our pelvic floor. So it helps us clear pelvic floor, from my understanding. So if a mama has a baby that's sunny side up when she's fully dilated, it's a bit harder to get them out. They have a higher rate of vacuum deliveries or forceps deliveries. So I would recommend the last few weeks, last month of your pregnancy, sitting like behind your couch and kind of leaning forward so you have that weight coming down and in all the time. You can do it sitting away from kitchen table and leaning in. If you go to bed and read at night, instead of lying on your back to read or your side, getting in like a child's pose, yoga position. Add some extra pillows up between breast and belly and be able to kind of hang in that position. Now, this is partly because my first one presented sunny side up, that when I went into labor, as soon as I went into labor with baby number 2, I got on my hands and knees as well, just to encourage second one to be in that right positioning. So I would say that's what I have seen in trying to prevent having a baby that's not positioned in the right place to begin with. But Lysa, what do you think?
Yeah, I know, I agree. And I had a C-section and then a VBAC, so same reason, sunny side up baby. But through my research, I've met Gail, who wrote and is doing spinning babies. So she does a fabulous, you can start, you know, as soon as you're pregnant, doing her exercises and getting ready for birth. And that's what I always refer everyone to, her website. It's just great. She really breaks it down so that moms can understand what's happening. And if your legs are strong and you're opening your pelvis, it's going to be a lot easier during the birthing process. But again, like you, I recommend, and it sounds silly, but sit like a boy. You know, boys always sit with their legs apart. So if you're sitting with your legs apart and your tummy forward, that baby's head is, the gravity is just going to pull the baby's head forward. So it'll help, even if that's all you do. Sit like a boy. So,
You heard it here, sit like a boy.
You know, I mean, and we were always told not to do that, right? So it's hard. And then your weight, you know, your body is changing, and so you feel awkward already. So to me, when I was pregnant, I liked sitting like that because it was just much more comfortable. So just give it a, you know, exercise. That's the big thing, you know, opening up your hips and giving the baby room. So.
Excellent.
Very good. How about, do you both have anything to say about managing contractions at home?
I'm going to leave Lysa all over that.
Well, early labor is probably the toughest for baby number 1 because it's usually a really long process. So resting is the best for early labor. The more you can rest, the more you can sleep, get out, walk, so that you're distracted and you're not paying attention to it. And then once labor comes, if you know, again, it depends on the woman, right? What is her style? What was she, did she want to meditate? Did she want to do breathing? you know, what were her choices to practice? And then we just go with that. Some people like a focal point and they don't want anybody in the room and they lock themselves in the bathroom and don't want anybody around. And other people want me right there asking for help with breathing or just distracting them when the contraction isn't happening. They want to be still and quiet in the moment, but then they want to be chatty Cathy in between. It helps them. Other people are, everybody's so different. And you just have to be prepared for whatever that is.
Mm-hmm. So for those who have hospital births planned, from both of your perspectives, what are some signs that it's time to go to the hospital?
Whenever they're ready. If I know we're still in early labor, sometimes it's good to go and let them hear, oh, you're 2 centimeters, you should go home, or you're 1 centimeter, and then we can go home and relax. Again, it's the personality of the person. Certainly when I start to hear grunting or something, we better hurry up, and I hope we're very close. But it really depends on the family and what we've discussed along the way. Do they want to get there, have time to settle in and readjust, or are they wanting to avoid being there as long as they can? And that is just such a personal decision and a family decision, not mine.
Mm-hmm. Mm-hmm.
Yeah. I think the way that my concerns about somebody going in too early is if they keep them. So say they're 3 or 4 centimeters and they say, oh, well, we'll keep you. If it's a mama that really has not wanted much medical intervention, there's a higher rate of chance of medical interventions. And if they're wanting to continually check to see how far dilated you are, there's a higher risk of getting infection, which then means you've got to be on antibiotics and you definitely have to be on an IV. And there's this cascade of concerns. I think I was one of those personalities that did not want to be until the last minute. Like, don't take me and make me be there for a long time. I want to get there and push and be done. But women, I would say, especially if they have some anxiety, they have some fear about it, being able to transition over and accommodate to the new space and meet their labor and delivery nurse, I think that could be really helpful. So just like Lysa said, being very individual to what that mama's personality is like.
Very
What's
good.
nice about being a doula is you kind of get to know that, and you can kind of have a sense of what that family needs, because it's not, it's a family being born. It's not just a baby. So it's a mom and a dad. And so making sure that dad is on board, because they're so scared for their child and their partner. So it's really important that it is a community decision and that everybody's on the same page. So that's really huge about when to go.
I like that. I like that a lot. In terms of C-section and vaginal deliveries, I think there's this misconception of if I get a C-section, there's not going to be any trauma to my pelvic floor. Can you guys share a little bit more about how the pelvic floor is still affected even with the C-section?
You go, Jenny.
I'll take this one. So we think about that the baby's head is coming down slowly within the pelvis, and that partly, that's kind of a 2-part question, is one, the head could be descended enough that you're still getting pelvic floor stretch, because we know we get pelvic floor stretch just during pregnancy. But also the repetitive pushing down on the tissue is over-lengthening muscle, it's over-lengthening fascia, as well as the nerves that come to the pelvic floor. So we know, especially when we're thinking about the pudendal nerve and the pelvic floor, which is kind of our main nerve that everybody hears about, that it can be challenged by either overstretch or compression. So if it gets compressed between your pelvis and baby's head, that can cause some concern, but also just repetitive pushing, because we have patients that have problems with chronic constipation or are really heavy lifters that hold their breath and lift. They're constantly pushing down. That is enough with a repetition to cause some injury or trauma to that tissue as well. So now I've forgotten what the start of that question was, Christina, to be able to pull it back around.
Oh, yeah, no worries. So the start of the question was just basically, is there trauma still possible for the pelvic floor with a C-section?
Thank you. And I totally forgot the C-section part of that. So if someone has pushed for 3 or 4 hours prior to them saying, this isn't going to be successful, the baby's either not dropping down enough, or they think that there is some size difference between baby's head and mama's pelvic outlet, and they switch to then doing a C-section, there has been some trauma to the pelvic floor just by the pushing. So we want to know that postpartum, because that gives us a little more indication of what are the things we need to be focusing on to help someone recover, versus just looking at what's going on in the abdomen and the C-section incision and just up above the perineum itself.
Very good. It's a great answer. And I think that question and that answer overall is just so powerful for women to just better be more understanding of what are my options, depending on, you know, what type of birth, how my birth went overall, what is my postpartum healing journey going to be like? And speaking of postpartum healing journeys, so the next month in August, we'll be talking a lot more about postpartum within our webinars and our speaker series. But Lysa, since you're on here with us today, I wanted you to touch on a little bit of postpartum stuff. So as a doula, I know you said you do more pregnancy birth prep, but overall as a doula and overall with doula care, what are some things that you guys look out for postpartum for a woman?
Well, does the mom want to breastfeed? So that's a really important, getting her all the resources that she needs to prepare for that before the baby's born, and then making sure I'm following up so that I know that she is getting care. If I know that she had a lot of fluid during the labor, if she had a lot of IV fluids, I always like to see them for lymphatic massage after to help get that fluid off. It's very effective with the breastfeeding and just her overall wellness, getting that fluid out of her. So, you know, I depending on the family and what their needs are, sometimes I follow up every other day for a month, and other people only want me maybe once or twice, and they have a postpartum doula, and I've got them set up with pelvic floor care, and I've got them set up with breastfeeding, and they're just feeling very confident. I maybe only see them 1 or 2 times, but whatever their family needs are, that's what I try to provide. Make sure that they have all the help. You know, something that's really fun and that I like all my clients to do is to do a meal train. And I always think that that's good. The last week or so of their pregnancy, up to a month, everybody likes to help. And it's so easy for them to get so exhausted and tired and not having to deal with going to the grocery store and preparing meals and thinking about all of that. So that is something postpartum that anybody can do, even if you don't have a doula, no matter what. Get a meal train.
I love it. I love it. So Lysa, tell us your big takeaways from today. We covered quite a bit of stuff in terms of pregnancy, birth prep, the birthing process, a little bit postpartum, but overall, what are your big takeaways for our women who are wanting a more empowered birth process and birth prep?
Again, it's individual, but I think getting information is important, and knowing how to take care of yourself, because if you're taking care of yourself, you're taking care of your family. So don't neglect your body, and make sure, eating right, getting exercise, it's all that normal life stuff that women tend to put themselves, especially if you have other little ones, it's much harder to take care of yourself. So yeah, get the information you need, reach out, get support, and don't forget to ask for what you need.
And for those who are thinking about looking for a doula, what are some resources that you recommend for that search?
You know, everybody uses their apps, you know, so get on there, ask your friends, ask your neighbors. You can Google it. If you're new to a community, I work with a lot of the military moms that don't have friends and family around. Yeah, and what kind of doula do you want? Like, think about it before you go. Interview several people and decide what's important to you. Do you want somebody that has a formal education, or do you want somebody who's your best friend and your mom, or in between? So, yeah, that's it. Google it.
Jenni, do you have any big takeaways that you want to share with us too?
Well, I think probably my favorite thing that people just aren't as aware of is the fact that oftentimes there are options to be able to birth in positions other than on your back. So if that's something you're interested in, you've had some prior injury, or you're really concerned about pelvic floor injury, if you talk to your birth professional and make sure that they are open to delivering you in alternate positions, and then being able to try out some of those positions, seeing a physical therapist that specializes in pelvic health to be able to get an individual assessment to see what positions might be really good for you. I think that's just something a lot of people don't know. So that would be a good take home for them.
Awesome. Do we have any questions in our chat box that we have to answer?
I had not seen any.
No. Okay.
No. I think we must have done a brilliant job in explaining everything.
All right. Well, we'll have our Q&A next week, right, Jenni? We'll have a Q&A for anyone who has anything from this webinar or our most recent Facebook discussion of the research articles. So the Q&A will be next week. So even if you don't have any questions to put in the chat right now, if anything comes up, feel free to join us for our Q&A next week, and we're more than happy to answer those questions. Lysa, do you have anything else to share at the tail end here? I think you did a beautiful job of answering these questions, and we're so happy and lucky to have you on our webinar today.
I thank you so much, and you guys are wonderful. Keep helping all these women in our community, and yeah, I appreciate all of you.
We appreciate you too.
One thing I just want to let people know, if they missed our Facebook and Instagram Live actually it was the first Wednesday of the month, the 8th at 11 o'clock, you can go onto Facebook and re-watch that. Christina and I went over 3 different research articles, one on pelvic girdle pain during pregnancy, one on diastasis recovery post-baby, and then one on how doing pelvic floor exercises during your pregnancy combined with aerobic activity led to a 50% decreased risk of developing postpartum urinary incontinence after. So if you want to hear a little bit more about the details, just go to our Facebook page and scroll back a bit to July 8th, and you could watch that there.
Thanks so much, everyone, for joining us. We are so happy to have you on here, and the video will be on for replay as well on Facebook, right, Jenni?
It will.
Okay, awesome.
Yeah. All right. Thanks.
All right.
Bye, everybody.
Thank you.
Okay.